go. Okay.
Hi, it's Jerry, and we are back miraculously with Gregg Hart, Chair of the Board of Supervisors, who has been leading the county response to the coronavirus. Gregg, thanks so much for taking the time. I know you're really busy. So I'm reading the economic news this morning, which is hotel use down 85%, airport use down 95%, restaurant employment down 90%. iModernary canceled, Solstice canceled, et cetera. But the public health news, it appears that we are on the road to flattening the curve, although Dr. Fitzgibbon says most of our community has not yet seen the virus. So I kind of want to take a step back from sort of what's going on daily and look a little more big picture. And the fundamentals, again, the coronavirus is everywhere in the world right now. Humans are immunologically illiterate. We have no defense against it, and it's a really bad sickness. We're not going to really have a back to normal situation until there's a vaccine, which is 12 to 18 months out. So the question for policymakers such as yourself is, how do we navigate that next year to the next year and a half? Obviously we've been doing it with a shelter at home, social distancing policy. We're still under the governor's orders, but it appears that we're getting to a situation where the money, the cost of doing this is beginning to erode our public finance ability to sustain this. So give me your overall take about where we are to now, right today.
Well, I guess I'd start by saying that I'm really impressed by how our community has risen to this challenge. I wasn't really surprised, but it just reaffirms my confidence in Santa Barbarans being able to step up to a really incredibly difficult situation and rise to the occasion. We've been tested a number of times lately, and this community knows how to do the right thing. And it's incredible, the response, which essentially is voluntary. Yes, the governor has an order and the public health officer has an order, but the sheriff's department and the police officers are not out citing people. We're telling folks what to do, and they're responding and they're doing the right thing. So as we transition from the first healthcare crisis portion of this response to a different response, it's going to be challenging and continue to be hard. And we're going to have to ask people to be patient. And these are extraordinarily difficult times. The economic cost is incalculable and unprecedented. And we are going to, I think, follow what the governor said earlier this week, that there are pillars of a framework that need to be implemented in sequence to provide the capacity to make sure that we can do this safely. And I thought the analogy that he used about this not being a light switch that gets turned off and things go back to normal, but is more appropriately a dimmer switch that will be moved to and calibrated to the facts and the circumstances, is a great way for folks to think about this.
Yeah, I heard another analogy, which I thought was good this morning, which is, when you jump out of a plane and you have a parachute and you open the parachute, it slows you down, and therefore do you take it off before you get halfway to the ground? I don't think so. So here's the question: have we flattened the curve in Santa Barbara County?
Yeah, I think we have, and I think the state of California has too. And I think that is the big change from even 2 weeks ago, and that's what the governor's responding, and that's why he's looking ahead, and that's why we are too. We're preparing for the next stage. We want to be ready in Santa Barbara County that when the governor makes the moves at the state level to lift or ease the order, that we have prepared and are ready to execute those. But there are some really significant medical technical challenges between here and there. And if you go through each piece of the governor's proposal, his first pillar is that we have the testing capability to make sure that we do know that the virus is not raging out of control and that we don't have community transmission. The indicators are encouraging, but we have tested so few people, we really don't know what's going on.
Yeah, let's go through them. Let's go through them. I want to spend a little time on the testing thing, because I think that's what people are most, first of all, flattening the curve, and I do think there is still some confusion out there about this. Flattening the curve did not mean we're going to eradicate this virus in our community. It meant we are going to slow it down to the extent that our medical facilities will not be overwhelmed. So we have done that. Now, in order to get a better sense of where it is, how widespread it is, we have to do this testing. And the lack of a widespread, robust national testing program seems to me to be the original sin in all of this. Where are we? How close are we to being able to have a testing system set out that would make that kind of big difference? And how long is it going to take us to get there?
Well, we're not going to probably have testing to do mass testing with the entire population of the county or the country in the foreseeable future. It would take a very, very long time to do that. But what the vision of the governor and the implementation of it at the county level will do is to increase testing to strategic audiences. You know, for example, we will need to, in order to protect residents of nursing homes, we will have to do testing of residents of nursing homes. We will probably have to test folks in other congregate living situations like jails and other facilities where there's a lot of people in a dense place, because we'll need to know immediately if there is someone that's positive so that we can isolate them and quarantine them and keep them from spreading the virus to others. The next step is that we will need to do some random sampling in communities to have a better understanding of the penetration of the virus in that community. So much like a political poll where you'd look at a random sampling that represents the demographics of the entire community, we'll have to have sufficient testing to do that, and to do that regularly so that we have feedback on whether there is community transmission. We can't wait until there is community transmission. We have to identify hotspots, be able to identify those individual patients, and then trace their contacts and isolate them and contain the outbreaks like we originally should have if we were prepared and capable of doing that. So we're essentially getting a second chance at that, and we will need the testing capability to fulfill that mission in order to meet that challenge the governor says with the first element of his framework.
And how many tests are we talking about having to have? Where are we going to get them? And are we on our own for that? Is that going to be coming through the state, through the CDCs? How are we going to get to that level? What does that look like?
Well, unfortunately, there is a national testing supply chain challenge. There is not enough equipment. There's not enough supplies. There's not enough nasal swabs. There's not enough tests to provide that capability to every community in the country at this point in time. There's a great disparity from county to county. There are some places that have more tests than others. There are some places that don't have tests at all. There are some places that have swabs, but they don't have vials for the swabs. The system is not rationalized and integrated. So it is going to take quite a bit to get to that stage. The state of California is working overtime. Our former public health officer, Dr. Charity Jean, is leading the testing.
How did we let her go, by the way?
Well, it's a good thing she is where she is, to be honest. She's using her talents to great effect for the whole state of California, and we're the beneficiary of that too. But there's a lot of pieces that need to be put in place just on the testing side. And in addition to that, when we get back to the old-fashioned track, trace, isolate, quarantine, which ironically is and historically is the same system that was used, in the Spanish flu. It's public health 101, blocking and tackling. We're going to need a lot more people to do that. We can't have the situation where outbreaks occur simultaneously and we don't have enough people to do that track and tracing. So we're going to have to staff up with trained people and have the resources to effectively make sure that what could originally start as small outbreaks don't become large outbreaks, or we'll be right back where we are again. And the sixth element of the governor's plan is the ability to reinstitute tougher sanctions and controls and public health orders to get that back under control. Because again, the critical piece, the purpose of bending the infection curve is to preserve the medical capacity that we need to treat patients so we don't have a catastrophe.
And do you feel like today that the medical facilities in Santa Barbara County, the hospitals and in the medical community, is at a point where we have a handle on that surge capacity? In other words, we are in a position to be able to handle what happens, whatever would happen?
Yes, I do think so. I think that we have the plans in place now, in particular for various increased staging capability, through a tiered system. When we reach certain benchmarks with the capacity of the hospitals, we can stand up additional facilities to take that load. We're working regionally with our partners in San Luis Obispo County and others to use the system efficiently and effectively. So that piece of the governor's pillar is in better shape than others.
So just to close on the testing thing, what window of time are you looking at? Are we looking at having enough tests by the middle of May, by the middle of summer, by Labor Day? What's your best guess about that?
I haven't seen any credible information about the timeline of the availability of the testing that we need to do the next step of the process. And because this is a national problem, this is an international problem. There aren't enough tests to go around the planet. So I am not privy to the details of what the work that's being done, internationally to make the supply chain for testing more robust. I know it's increasing. I know that we have gotten additional capabilities here locally, and the state's working really hard to fulfill that. But how fast they can do that to get us what we need to do the next step, I don't know the answer to that question.
Which means for now, the testing is number one on the list. That's the threshold issue that we have to be able to address. Until we address that, then we're going to be continuing with shelter at home, social distancing, correct?
Yeah, I don't think there's any way to get around that. The fact is that we can't move to the next stage blind. We need to know what's happening, and we need to know in real time, and we need to be able to assure people that as we gradually open businesses and have more people mixing together, we don't cause a huge outbreak in the virus. That was the reason we have bent the curve, is the significant order and the stay-at-home order that people have been practicing. That's why we accomplished what we did. When we stop doing that and we don't have the ability to test, we'll be right back where we were before.
Right. So there are no immediate plans to, quote unquote, begin to open up the economy, whatever that means.
Well, the governor's framework describes the steps that have to be achieved in order to safely do that. And we're preparing here locally as best we can to meet the challenges that we have and control. But we're going to need assistance from the state and federal government to make that happen. We're going to need more testing supplies and equipment. We're going to need help financially and staffing to do more track and trace and isolating work. And that's our message right now, is we're looking to our state and federal partners to have the assistance that we need to do this, to reopen our economy, which is what everyone wants to do. We want to get back to work. We want to do it as fast as possible. We have to do it safely.
And what do you say to people who say, oh, this was just a bunch of alarmists? Look, there's only 3 people who've died in Santa Barbara County. There's not that many cases. I don't know anybody who's been sick. This was all a hoax.
Well, the reason that there have only been 3 fatalities in Santa Barbara County is because we've been staying home for a month. If we hadn't, that would not be the case. And all you have to do is look to Italy or to New York City to see what the outcome could have been. This is a great proof of how well our community met this challenge.
Okay. All right. I want to talk a little bit about some of the scary financial numbers that you disclosed yesterday. That to date, we've had the county $7 to $10 million specific costs for addressing the pandemic. We've lost probably $30 million in taxes and state funds. And that's all for the current fiscal year. So we are talking about a $37 to $40 million hit in the budget in the fiscal year in which we are in, which ends June 30th. Is that correct?
It also includes a little bit into the next fiscal year as well, as far as we can reasonably project. But it doesn't capture the impact if this were to continue for a very long time.
Yeah, so that is not talking about any of the out years about how this is going to go, and we're looking at a recession. I think I read a projection from one of the rating agencies this morning that the state of California is going to lose 1 out of 5 tax dollars in all this. So there's also going to be a downhill effect. And the big problem seems to me, or one big problem, there's this 500,000 population threshold in the federal legislation about how you become eligible for stuff, and we are obviously under that. What's your perspective on that? Is there a way to go back on that? get another bite? What's happening with that?
Well, we're working very closely with Congressman Carbajal and our state senators and United States senators to try to address that inequity. It was a line that was drawn for the first tranche of federal stimulus funding and local assistance dollars. We fully expect and need for there to be a second version of that would include us to help us provide the resources to do the job that we're being asked to do. You know, there is only so much money that we have, and we need more resources from the state and federal government to do the new work that they are asking us to do and that we want to do to fulfill the mission of reopening our community.
So if we look at it though, you know, we have spent this substantial amount of money on which obviously nobody expected on addressing the pandemic. The revenues are being undercut. Going forward, we're going to have to continue to spend at least that much, if not more, with less revenue base. So when do those two lines cross? I mean, what are we looking at here in terms of how we navigate this financially?
Well, we fortunately have been preparing for tough economic times. The previous boards before I got here and the city council when I was elected there did a great job of creating strategic reserves that will help cushion the immediate impact. You know, we have nearly $30 million in reserves at the county level, and that will help to get through this initial period, but it is not sustainable permanently, and we need the backfilling of the additional costs that we have from our state and federal partners to continue to do the extra work that's going to be required until there's a vaccine. It's not like this is going to end and the need to do testing and tracking and isolating and quarantining doesn't stop in a couple of weeks or a month. It stops when there is herd immunity in the whole population or a vaccine. And I'm hoping that it happens when we have a vaccine and not everybody in the country has to get sick with COVID to get to that safety place.
Let me ask you a couple of questions about the situation at the Lompoc prison. It seems to me that that's one of these classic cases of, you know, you kind of have all of the responsibility, but none of the authority, because the conditions within the prison and how both staff and prisoners are being treated medically are not in your control. But yet, if that breaks out, then the medical care is going to be foisted onto the county. What's your analysis of where that situation stands right now?
Well, I think that's number one, a perfect description of the situation. We do not have control or authority over the operation of the federal prison. That is the responsibility of the Federal Bureau of Prisons. Fortunately, we have a good, close working relationship with the prison authorities. Our public health department has assisted them many times in the past when there have been infectious disease outbreaks. So we have good relationships. We've also are working very closely with Congressman Carbajal and Senators Feinstein and Harris to use their influence at the federal level. This is the largest COVID infection outbreak in a federal prison in the country. So far, we have been able to handle the medical implications of that, but one of the critical new infrastructure pieces that we need is a field hospital at Lompoc Prison. And we've asked for that. It seems as though that is on its path to occurring. The Army Corps of Engineer people have been out to the prison to look at a building that could be used for this purpose and to begin preparations for it. But our initial response back from the Federal Bureau of Prisons was that it might take a couple of weeks to get that going, and we need it to happen much faster than that. And that's exactly what our representatives at the federal level have communicated to the prison, and we're really hopeful that they will be able to do something quicker. But we're working on a daily basis with that. The county public health department is going out to the prison and offering testing for all the inmates and all the staff there at the hospital to make that easy for them to do. All of the medical providers are working collaboratively. We're working with San Luis Obispo County too, to potentially have them assist if there's a surge that exceeds our capacity. But fortunately, the modeling that we have locally indicates that we should be able to absorb even the worst case scenario that could occur at the prison right now. So
did I just hear you say that the county store of testing is being used at the prison?
Yes, we're using some of our testing equipment to test their staff, because their staff come back into our community. And that's important to know. We want to make sure that if they have issues with their staff, that they are appropriately quarantined, because we do not want community transmission in the communities around the prison.
And as for the prisoners, they are also we are also using county tests there, or is that the federal penitentiary?
I don't know the precise answer to that question. I know for certain that we have offered it to staff. I'm not positive about the testing of the prisoners.
All right. What about the immigrant population in Santa Barbara County? Obviously, we have farm workers. We have an extensive immigrant population. There's this huge conflict between the federal government and the state government. A lot of people probably are afraid to seek medical attention. Tell us, paint us a picture of where that stands.
Well, the first and most important step was public education. We need to let everyone in the community know about the problem, what they need to do to be of assistance to it, the simple hygiene and steps that you can take to modify your own behavior to protect us. I'm really proud that we're working with the indigenous communities in North Santa Barbara County, the Mixteco and the Oaxacan communities. We've got videos that we're putting out through various sources to get into that community. The press conference that we hold every day is translated into Spanish. We've done a lot of extensive extra outreach into the Hispanic populations all throughout Santa Barbara County, but particularly in North County. So getting the word out to that population, I think that our Santa Barbara County Public Health website was the first website in the state of California to have fully translated documents. So we're leaning into that challenge hard.
And what about the homeless situation? I know the city of Santa Barbara is working with the county and so on, trying to get, or I guess have already obtained 68 beds for particularly people who are at risk within the homeless community. Where does that stand?
Well, the first thing the county did was to stand up a shelter in Santa Maria at Santa Maria High School. It has about 70 beds. And we were using county staff and county resources to run and operate that shelter. The reason for doing that first there was because initially services to the homeless during inclement weather has been provided by the Freedom Warming Centers, and their staff were very concerned with the outbreak of COVID about infection of their volunteers and fundamentally the problem of bringing people into a congregate living center and the potential for the spread of infection. So they were stepping back from their traditional role of helping the county by providing those warming centers. So we felt it was important to get a replacement for that. Santa Maria High School became available. We stood up that operation. We've had real challenges in operating that. And fundamentally, I think the real policy question is it a good idea to bring everybody together into one place? And that is an open and serious question. It's a great thing to provide food and shelter and facilities for people, but bringing them together is inherently dangerous. So we have now shifted to an operator that is more experienced and better able to do that. Good Samaritan Shelter in Santa Maria is running that shelter for us now, and they're doing a great job. We have shifted the model in South County and want to open a hotel that would have 70 rooms available so that we don't have people gathering in the same place. That probably will open early next week. We have a provider down here now that has done that. We've found a site. We're inking the agreements on that. It should be opening very soon. Ultimately, I think we'd like to transition the model in Santa Maria to a similar non-congregate situation so that we don't have people concentrated in one place. And of course, these services are limited, so we're going to have to do some tiers of availability, and individuals that are over 65 that have pre-existing medical conditions will get first crack at those facilities. So in addition to those, which are very limited in their response and ability to help, we are doing more outreach to the community, giving them education about COVID, hopefully very soon distributing masks to protect them. And then we've also increased the number of hand washing stations, meals that are provided, showers, other hygiene operations throughout the county to help address that need.
Is there consideration being given to adding a requirement that people wear masks when out in public?
Yeah, I think the direction from the public health department is it's a good idea. We should do it. Hasn't turned into an order yet. The science is gray about it, but I think it's a good idea. I personally am wearing a mask every time I go out. I think it'd be great if everybody did.
And what about our recreational facilities? Because obviously a lot of people have cabin fever, want to get out, and there's been some concern about overcrowding on trails, overcrowding on beaches. What's your assessment of that?
I think folks have done a really good job. You know, I periodically do my own little survey. I personally am a hiker. One Sunday I went out to go to one of the trailheads and saw 50 cars and said, wow, this is a really bad idea. And, you know, I know enough about where there are other trails that I had a plan B, and I went to a different spot where there was literally nobody. So I think that is the answer. If people can be a little bit more prepared when they want to go do something like that, to have another option in mind. And if there's too many people doing it in one place, move to another. We've got literally hundreds of miles of trails in Santa Barbara County that are available. Same with beaches. If you go to Henry's Beach and you see too many people, go to another beach. But what I've observed is a lot of compliance. You know, there may be a lot of cars, for example, at Henry's Beach, but people are getting out onto the beach and they're distributing and they're staying away from each other. And a lot of folks are wearing masks. Of course, there are going to be people who are not getting the message and not following what we're asking. But that has so far been a really relatively small number of people.
All right, Greg. I thank you so much for your time. But I want to just recap, if I could, to make sure that everybody understands the same message. What I hear you saying is that our social distancing and shelter in home compliance has been successful. We have flattened the curve, but at this point, there is no set date or even close to a set date where that is going to lift. Is that correct?
The way the order of the change and transition will occur is starting with the governor. The governor is going to announce, you know, he believes that we have the capability to move through his framework and get to a different place. The responsibility of executing that will fall to counties, I think. That hasn't been clearly enunciated, but reading through the lines of the governor's remarks, that's what I understand and believe. We are in the process of determining exactly what that would mean for us and what we need to do to meet that mandate, and are communicating that to our state and federal partners and saying, you know, we want to do this. We all want California to get back to work, Santa Barbara County people to get back to work, but we need the resources to fulfill the job that you're making us do and asking us to do and wanting us to do. And that's step two.
And obviously that is entirely or almost entirely dependent upon a testing system, both the supply of all of the various pieces of that testing protocol, as well as the ability of labs to turn tests around quickly. And what is, again, you know, what is your take on what does the window look like for that?
I don't have an estimate of the time. I know that we don't have enough of that capability today to fulfill that part of the governor's framework, and are hopeful that as the systems are ramping up, and I know lots of people are working really hard across many different industries to make that happen. And as I mentioned before, Dr. Dean at the state level is the head of the testing task force. They're working overtime to make that happen too. Hopefully that will occur to the extent that makes it possible. We're not talking about having tests available for every American and every Santa Barbara County resident, but we will need enough tests to test strategically and carefully to make sure we don't create new outbreaks.
Right. Okay. And it seems to me that, you know, we're not at the end of the beginning here. Right? We are at the end of the beginning, not at the beginning of the end. I mean, we're in this for the long haul going forward, both economically and in terms of public health. So what's your bottom line message?
People should just continue to do the simple things. Stay home. If you go outside, wear a face covering, stay at least 6 feet away from other people, and practice good hygiene. Wash your hands regularly. Don't touch your face. Wear a face mask when you go outside, and disinfect surfaces. If you feel sick, isolate yourself at home. Don't go out. We're learning now that you have the ability to spread the virus pre-symptomatically. So imagine that you have COVID-19 now and act as though you do to protect others and yourself and your family. And those tools, those simple blocking and tackling tools, are the key to this virus. And that's not going to change. when the governor lifts the stay-at-home order. We're going to continue to have to do all of these things. And, you know, ideally we will build infrastructure and rules of business operation that protect people and allow folks to go back to work. It probably is going to require staggered business hours. It's probably going to require, you know, reduced occupancy in facilities, may require taking people's temperature before they come into a facility. There are many, many steps of this. The implementation of the next phase, as you described, is complex but critically important. We can't find ourselves going in a continuous loop of opening up too much, having outbreaks occur, forcing us to go back into stay-at-home orders. We have to figure out how to use that dimmer switch effectively and strategically and smart to make this work.
All right, Gregg, thank you so much. You know, we've had such a unlevel ability of communication from federal, state, and local, and I just want to congratulate you. I think you've done a great job about being factual and calm and very direct and candid with people. Thank you so much.
Thank you, Jerry. I really appreciate the opportunity to share this information with your audience. The press conferences that we do on a daily basis is a transparent way to communicate the same message, and I think it's been very helpful. And I really want to emphasize how proud I am of our community for stepping up into this moment. I know we can do this. I was thinking back to something I read that Winston Churchill talked about during the bombing of Britain, and how folks were very scared about the psychological impact that that would have on the British people. But as a matter of fact, what happened is the places that were bombed the hardest had the greatest esprit de corps and the greatest community building moments, because they were in this together. And I think this is our moment like that, where we are being tested and we are rising to the challenge and really doing an incredible job. And I just couldn't be more proud of our community.
All right. Thanks very much, Gregg. Thank you.
Thank you.
Push that button.